Chollima movement.
As briefly mentioned earlier, the Chollima movement, begun in December 1956, was a mass movement that brought about a remarkable revolution across North Korea, ideologically, culturally, and technologically. Simultaneously, it was also a prime example of a success of a low investment, high growth strategy to overcome internal and external crises. The success of the Chollima movement in overcoming internal crises of accumulation in the mid-1950s has been invoked in subsequent crises facing the North Korean regime. Over the course of the 1950s, Chollima movement became a broader ideology that applied to the entire society, not just production workers who were directly involved in economic indicators. As we've seen in the case of the devotion movement, Chollima movement also had a profound impact in the field of medicine, where healthcare, which had been in the auxiliary position to production, was brought into production field through Chollima movement and begun to be mentioned as one of the indicators of full-fledged productivity. At the same time, it became even one of the main actors of Chollima movement. Since shortly after the liberation in 1945, healthcare in North Korea has been most emphasized in its role to support the preservation of labor capacity. From 1947 onwards, new forms of health institutions began to emerge, such as industrial hospitals and occupational health centers, which were set up around production sites. In 1948, institutional regulations on occupational safety were put in place, requiring factories to have safety facilities and staff in charge of. This increased the total number of outpatient clinics in industrial districts from 56 in 1945 to 283 in the first half of 1950. The reorganization of healthcare resources, which had been poor in the immediate aftermath of liberation, around factories demonstrated the importance attached to labor conservation in North Korea during this period. Despite these efforts, with the outbreak of the Korean War, North Korea experienced a severe decline in adult male population and loss of healthcare facilities and workforce. From 98 in 1948, the ratio of men to 100 women in the 20s to 40 age group dropped to 80 in 1953. With many of the healthcare personnel sent to front lines and lots of facilities destroyed in the course of the war, the lack in healthcare resources got deepened. The North Korean government made several efforts to conserve its limited labor force. In this context, industrial accidents were highlighted. During the post-war recovery process, injuries of workers who were deployed to construction sites and industrial facilities became frequent. As industrial facilities were concentrated on the sectors of construction and manufacturing, workers who had previously worked in rural areas began to be flooded into new industrial fields. Unskilled workers were particularly vulnerable to industrial accident and injury, with 44.9% of occupational injury patients having worked for 1 year or less, and 30.5% having worked for 2 to 3 years. As safety education for unskilled workers and provision of safety facilities emerged as major healthcare priorities, greater emphasis was placed on field accessibility of healthcare personnel from 1955 onwards. Beginning with the establishment of mine infirmaries in 1955 that was staffed by paramedics, outpatient clinics began to be established at enterprises where actual labor was carried out. However, Staff working for outpatient clinics were not professionally trained doctors, paramedics, nurses, or other secondary health personnel. They were mostly staffed by picking and choosing among the laborers in the field who had either short-term training or no professional healthcare training at all. These first aid schemes were limited to providing primary care and transporting patients.
Low investment, high growth.
Despite these limits, knowledge of labor conservation was able to become increasingly professionalized on an institutional basis, based on the expansion of healthcare facilities to the grassroots during the post-war 3-year planning process. Information on the causes of labor losses that occurred mainly at production sites began to accumulate. Around 1955, healthcare facilities were expanded at most major enterprises and industrial sites, and medical personnel were deployed, enabling hygiene improvement projects to be carried out. In consideration of the specific processes and site characteristics of each enterprise. From 1956 onwards, industrial safety studies based on the characteristics of individual industrial sites were actively conducted. Mainly at the Labor Hygiene Research Institute in 1956, when the infrastructure had recovered to some extent to its pre-war level, and the institutional foundation were in place, North Korea was facing internal and external crises. When the post-war 3-year plan was coming to an end and the first 5-year plan was about to begin, foreign aid plummeted and forced development plans to be implemented with internal North Korean resources. Also, conflicts emerged within the party over the economic line of heavy industry prioritization advocated by Kim Il-sung, along with a criticism of personal worship. These conflicts culminated in the August sectarian incident in which a section of party leadership turned against Kim Il-sung. Prior to this power struggle, there were intra-party dynamics that could have checked Kim's dominance politically and economically, including the economic development lines, the setting of growth rate targets. However, after the failed offensive from the opposition and the widespread purge against them, the removal of internal checks enabled Kim Il-sung to adopt a high-growth policy that prioritized heavy industry. With no resource from external aid, he pursued Chollima movement, a low-investment, high-growth strategy that sought to maximize the mobilization of spare resources not counted in the economic development plan, reduce resource waste, and increase output as much as possible. The active participation of the working masses was essential for this strategy to succeed. However, the goals pursued in the first development plan was difficult to achieve without increasing the absolute input of labor. In 1956, the Third Congress of the North Korean Medical Association identified the first task of healthcare as improving working conditions in industry and preventing occupational diseases. It also determined that the purpose of medicine was to assist labor productivity in the process of driving maximum expansion. It was essential to reduce the temporary loss of labor capacity within the limited labor resources.
Labor control and medicine.
The sincerity required for healthcare workers, and later the devotion of the devotion movement, did not just mean dedication by healthcare workers. It also included all possible measures to return patients to labor force, including works of reforming their lives and ideas. In terms of reducing the temporary loss of labor capacity, simply providing medical treatment has its limits. It required a fundamental change in attitudes of all those involved in production to prevent the loss of labor capacity. The work of sanitary inspections and the issuance of doctor's note, carried out by healthcare professionals on the production floor, was a direct intervention of the state and medicine into the lives of workers to fundamentally prevent this loss of labor capacity. In 1959, compared to 1957, there were 26.2% fewer days of temporary incapacity for work per 100 workers than in 1957. And this increase in working days could indeed be seen as an effect of enhanced safety in the workplace and a reduction in illness and injury. But at the same time, it could also be interpreted as a result of the medical eye on and control of workers' idle time, drawing maximum reserve. Access to production sites allowed healthcare professionals to observe workers' daily routine more closely, and hygiene inspections allowed for direct intervention. The issuance of doctor's note, which was managed as one of the indicators of production, was transformed into a time to reserve labor for gaps caused by illness. In other words, healthcare, which had remained peripheral to production, became one of the integral elements of the production site during the Chollima movement. As healthcare was proved to be a highly effective tool for labor control and an effective mechanism for infiltrating micropower into the individual workers, it was given a greater role. The Chollima movement in healthcare was not just about drawing out the reserve, as in other industries. It was around the same time that communist values and morals, such as dedication and service, were emphasized with the intensification of the Chollima movement in 1959. On June 7th in 1961, Kim Il-sung proposed to popularize the Chollima movement at the National Health Workers Conference. He noted that the physical care and affection of doctors and nurses for their patient played an important role in treatment. He also emphasized that these instances of miraculously saving patients with their own blood, flesh, and bones could only be found in socialist and communist societies, and could only be carried out by Red Health workers, armed with communist ideas. He said that when the transition from a socialist society to a communist society was over, other officials such as people's commissars might disappear, but doctors would remain indispensable. This elevated the role of healthcare workforce, saying that they would be responsible for converting the entire population into communist. As the example of the dedicated Chollima movement in healthcare professional was developed into mass movement known as the devotion movement. The role of healthcare was changed from being auxiliary to the construction of transitional socialism to being the pioneer of human transformation that mediated the transition to a communist society.